Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guest is Gabriel Martinez with Senior Whole Health. Welcome to the show.
Well, thank you, Peggy.
Can you please tell us what you do for Senior Whole Health?
Yes, I am the Director of Marketing and Branding for the states of New York and Massachusetts where we operate.
Okay. And tell us a little bit about Senior Whole Health. What kind of an organization are you?
Well, we are a Medicare Advantage company. We specialize in individuals that are over the age of 65 and that have both Medicare, qualify for Medicare, and also Medicaid, state Medicaid. We are a high-touch insurance company that really provides individual care to every one of our members, where it does allow us to really mold and put some assessment behind any decision that we make to help our members be safe and independent at home.
Okay, so it's not just about paying for a test, it's more about making sure that there's a whole health perspective on them doing well, basically, right?
That's our mission. Our mission is not paying just for the test. I mean, that to us is a given. It's everything else that we provide them with. We provide them with a personal care team, provide them with individuals that know their plight, understand where they're coming from, and really provide them with tools to keep them, again, independent at home within their community.
Okay. And Senior Whole Health is offered in Albany County, correct?
It is. It's offered in the capital region. That includes Schenectady, Rensselaer, Saratoga, and Albany.
Okay. Are you in the midst of expanding into other parts of New York State?
Yes, the good news is that we are offered in 6 counties. And that includes the 4 that I just mentioned, and also Ulster and Dutchess.
Okay.
We're expanding in 2010 to 6 additional counties that are in the northern, in the capital region, and they include Columbia Green, Warren, Washington.
Okay, great. That's exciting. Okay, we're here today to talk about health literacy. Can you please define what health literacy is?
Health literacy is very simple. It's the understanding how to communicate and understand what your medical provider tries to explain, and how can you then understand it to a point where you can actually affect the outcome.
Right. I have to say that as the consumer health librarian at the Colonie Library here, I tend to get a lot of people that come in after they've visited the doctor asking questions because they didn't understand or they didn't catch what the doctor said. So it's I think a very common thing, and it's not just seniors, it's all ages, and it's not just doctor visits, it's testing, it's medicines that they're taking, it's everything.
Right. When we talk about a medical professional, we talk about anyone who actually provides you with the care. That could be your doctor, it could be the pharmacist who you're picking up the medications, it could be the individual that actually draws your blood, the one who's actually the x-ray technician. All of them are medical providers in our eyes. And what we try to do with the community is really educate them into giving them the tools so they can ask questions, so that they could be more empowered of understanding what they have, if they have anything, how they can improve their health, and legitimately understand there's a sense of putting together some pieces that are out there, and how can you put them together so that an individual could make choices that they're more informed of their choices, is the way I would actually say.
Right, and I also think generally there's this mindset where a patient goes in, they feel like they don't want to take too much of the provider's time, they're busy, and they feel like they don't have the rights to get the answers that they need. And they are embarrassed when they realize they don't remember what the person said or they don't understand what the person said. So we have to, make sure that we understand that we're the consumer, we have our choices of providers, and they're here to help us.
Well put. I think that as long as you're able to empower the consumer, the patient, by providing them tools, again, to really communicate, really make themselves understood,
Yeah.
we've gone a long way. The statistics are alarming. 8 out of 10 individuals that leave the doctor's office do not remember completely what the doctor has told them. That's an incredible number.
And that's all ages, all income levels, all education levels, everybody.
Everyone.
That's
So,
amazing.
It is amazing.
So if you don't understand, if you don't remember something, well, basically that might mean that your health can be affected.
Yes.
How can this affect your health in a detrimental way?
Well, it could. If you don't remember what they've told you, then there's no way of actually doing something that will allow to stabilize the outcome, or actually to improve it, or to actually maintain the outcome. If you're a healthy individual and the doctor tells you you're doing everything right, but you should be looking out for X, Y, and Z, if you don't remember that X, Y, and Z when you come out of the hospital, when you come out of the office, then at that point there might be something that you can do to improve that.
Right, absolutely. Let's see, what problems are most associated with a lack in health literacy?
Problems that are most associated is individuals who do not understand their condition. For example, individuals go in and their physician says, you're suffering from hypertension.
Mm-hmm.
The patient nods and says, okay, fine, and I'm going to prescribe some medication for hypertension. Most of the time, that hypertension, what is hypertension? The individual should actually, our presentation is one where we ask of that patient, if they don't understand what hypertension is, to actually ask the physician and say, by the way, I'm pretty new at this. One of the ways of saying this is, I'm pretty new at this. Could you explain that a little bit better for me? Mm-hmm. At that point, I think it's a cue on the provider side to say, hypertension is high blood pressure. And as that, high blood pressure is caused by X, Y, and Z, and we would like you to take the medication along with other factors.
Right. Yeah, I think the provider is a big part of the educational part of all of this. And if they're not willing to spend the time with the patient really has to sort of fight them to get them to talk to them. What I'm wondering is, what is Senior Whole Health doing in upstate New York for seniors?
Well, in terms of the Ask Me 3, the health literacy initiative, we've partnered with this. Ask Me 3 is a national health literacy initiative. And what we've done is we've partnered with them to actually develop material and distribute material and do training in all places, in every location that actually would have seniors. That would be libraries, community centers, senior centers, large churches, okay, where we can educate individuals on this program, which is, you ask, what is Ask Me 3? Well, Ask Me 3 is the 3 basic questions that you should always keep in mind when you communicate with your provider.
Okay.
The 3 questions are,
Mm-hmm.
the 3 questions are, what is my main problem if I have a problem? Second question is, what do I need to do to actually address this problem? And the third is, what would happen if I do not do what you've asked me to do?
Uh-huh.
So the first one is the first question is, what do I have, which is the diagnosis. The second is, what do I need to do, which is the treatment, really. And the third is, what do I need to do what should I expect if I don't do it, which is, what are the outcomes? What is it that I expect? What should I expect if I don't follow your direction, if I don't go on a diet, take medication, do exercise, any of those issues?
Right. And are there tips that you have for when you're asking the questions? Should you have someone with you? Should you write things down?
Very, very good question. There are tips, as the whole program, the whole initiative is to provide them with the 3 questions and then provide them with tips that allow them to better communicate with the physician. One of them is to write if they feel there's something wrong with them, write that beforehand, write it, and then bring it with you to the doctor. Another is bring someone along. 2 sets of ears is better than 1.
Yeah.
The other one is actually write down what the doctor is saying so that you can better understand and recall this when you leave the office. And the other one is actually to bring a list of all your medications, all your medicines when you go into the doctor. I think it's important for individuals to make the physician understand what medications you're on, because a lot of them, they're seeing 4 or 5 physicians, and each physician might not communicate with each other.
Right. Yeah, that is very important. But, you know, as you said, it's not just about when you're seeing your primary care. And it's not just about when you're seeing your podiatrist or your dermatologist or whatever it is, but it's when you're going for a medical test. It's when it's all of the different things that we do for our health that we should be asking. And you're also educating the providers, right, in the initiative?
We are. We're a health insurance company. As a health insurance company, we have a provider network. What we're going out is actually going to the providers and really educating the providers to communicate with their senior population in a way that's much more understandable, in a way that people understand that you should be using regular words rather than medical jargon, in a way that you should give them an opportunity to speak to you in 30 seconds or 60 seconds, in a way that they should not be intimidating to a patient if a patient starts writing things down, in a way where they should give them tips, that same tips that we're providing to the patient, they should provide them with the tips. They should ask them, did you bring anyone along? Do you want me to explain this to someone? It's okay for us, did you bring a list of your medications? Can I see that list? Mm-hmm. Those are the types, and you don't lose anything by asking those questions, but you actually are more knowledgeable of the full person when you actually provide them with those tools.
Gabe, you mentioned the list of medications. I think it's important that people should always have the list of medicines on them to give any provider that's helping them, but also in case of an emergency, they'll have it in their wallet so that it's known what they're taking. I think that's really important. The other thing is that, you know, these are really useful questions, and I think if somebody has an appointment with a provider, they should always bring them, whether they're anticipating a long discussion or not. You know, I personally have been hit with something that was a serious problem, and I could have used the questions to help myself. I didn't know what to do. So I think that's really important that we talk about that. You mentioned that Senior Whole Health does presentations on the initiative. Who can receive the presentations, and how long does it take? What do you cover exactly?
Well, the presentation is a 15 to 20 minute presentation.
Okay.
It's really, the core is 10 minutes, really giving them the tools, giving our audience the tools, going over the 3 questions, going over how they should ask those questions, who they should ask about these questions, who they should ask these questions to. Being prepared, as you just mentioned, regarding these 3 questions, always carrying them along, bringing a list of your medications everywhere you go, because it's important, emergencies, non-emergencies, it's important for you to understand what you're in. So it's a 15 to 20 minute presentation. We actually make it available to any senior center, community center, anywhere where there's an audience of individuals that are willing to learn about this program. It really is independent from Senior Whole Health. It's one that we truly believe in, because we do think that it will affect the ultimate outcome of our community's health. The way that we are at this point set up is that you can certainly give us a call, and we could provide you with the information of where and when is our next presentation.
Okay. All right. Let's review the 3 questions once again in case people didn't get them.
Okay. First question, what is my main problem? Okay. What is wrong with me, if there's something wrong with me? What do I need to do, which means what is it that I have to do for my part to actually, and the third one is what would happen if I don't do what you tell me I should do? So what's the outcome? what are the consequences behind it? Those are the three basic questions. What we do in our presentation also is provide them with flyers where those three questions are actually part of this flyer. And they could take as many flyers as possible. So every time they go into a presentation, every time they go into a doctor's visit, they could bring their flyer with the three questions.
And you actually have a flyer that has the lines that you can actually fill the answer in.
Exactly. We have a flyer, and that flyer is actually distributed when we make our presentation in any of the venues I just described.
Yeah, and we're actually going to try to get some of the flyers for the library too.
Oh, that would be perfect.
I think that's important. And you also have them in different languages, right? It's not just English.
We have them available in different languages. The initiative covers English, Spanish, Russian, and Chinese, and there's other languages depending on the community that are made available. So we translate the information into different languages.
Okay. And for further information, let's mention a website for the initiative.
Well, there's two websites I can mention. One is my website, our Senior Whole Health website, which is www.seniorwholehealth.com.
Okay.
The other website, which is part of the initiative, is www.askme3.com.
Okay. And there's a lot of information on there. It says literacy resources, clear health communication techniques, and examples of simple interventions.
That's correct. There's a lot of resources, there's a lot of publications, there's a lot of information, but it's very simple information where it all is geared to these three basic questions. So they provide you with a lot of information, but actually all of it is funneled into those three basic questions.
Okay. And I also want our viewers to think of their town library as a source for information too. So if they don't get enough information from their healthcare providers, they can also ask us for additional information. Thank you so much for coming in. You did want to mention a telephone number, right, for Senior Whole Health?
Yes. Our telephone number is an 800 number. It's 866-211-1777. Once again, it's 866-211-1777.
Okay. Gabe, thanks for coming in.
Thank you for your time. I appreciate this.
Thanks for watching. We hope to see you next time on Focus on Health.